Constipation is an incredibly common condition affecting children. I'd argue it's probably the most common thing that we see in the office, especially during the period of time when kids are starting to potty train and also when they're starting to go to school and having other life-changing events. Constipation is diagnosed based on history. A good history from families and from the patients is going to really tell me, are you constipated? It doesn't take any special tests, it doesn't take any special imaging. Now, how do we treat it is another story. Treatment of constipation is going to be with multiple things. Number one is going to be behavioral changes. Number two is going to be diet. And then number three is going to be medications such as stimulants and stool softeners. Encoparesis is a condition which is a magnified version of constipation. Patients with constipation wind up having accidents and overflow of their stools. And with the overflow of their stools, it can be both embarrassing socially, but also very difficult on the family. Encoparesis is treated just like constipation, but it's going to be a modified version of our treatment of constipation, where we really empty out the patient's complete bowel and we start from a fresh slate. Hersheys disease is a very rare condition when the nerves don't develop properly in the colon. When the nerves don't properly develop in the colon, stooling issues occur. Typically, this is diagnosed early on in life, within the first couple of days of life, but sometimes it goes undiagnosed. Depending on how much of the colon is involved is going to be how the patient presents. It's typically going to be diagnosed with a biopsy of the tissue in the colon, and we check for the nerve endings. The treatment of Hersheys disease is to remove the affected part of the colon. Now, while that's surgical, patients with Hersheys disease, even after the surgery, tend to have issues with stooling, and so they wind up following with a pediatric gastroenterologist and a gastroenterologist really for the rest of their lives.